Welcome to the Express Soul Health and Wellness Podcast. In each episode, you'll learn from experts about the best practices and technologies to live a happier, healthier, and hopefully a longer life. Here is your host, Claudia Erdenola.
Dr. Santiago Figuereo is our guest today at Express Soul Health and Wellness Podcast. He is a neurosurgeon, and his expertise into the field of neurology is here in full display to tell us everything about what is the key for longevity. What are those elements that, in his professional opinion, are those to learn from to keep our brains healthier, vibrant, and our overall health better for longer time. Also, we're going to discuss everything about Alzheimer's, and we're going to talk about artificial intelligence. What are those technologies that are today here with us to stay? And what will be those main contributions for mankind in the healthcare field? How we going to benefit from it on the medical field as consumers? So if this is something that is of your interest, please don't forget to subscribe. Subscribe to our podcast right here and hit the notification button so you will know every time we're posting new content in our channel. Also, check our sponsors below. All of the links are included in the description box. Thank you, and here is our interview with Dr. Santiago Figuereo. Also, check out our sponsors as we have great discounts for our listeners. And follow us in our social media outlets. We really appreciate your support. Thank you. Dr. Figuereo, welcome to Express All Health and Wellness Podcast. How are you?
I'm doing very well. Thank you, Claudia, for having me in your podcast today.
Wonderful. We're going to have a delightful conversation because on your expertise on neurosurgery, you are an expert on less invasive procedures for some of those neurological conditions. So we're very, very happy to have you here today. We have some questions and some of the subjects that some of our audience also refer to us that we like to hear. So this is perfect. The first one I would like to ask you, first question is, what is Alzheimer's? We're going to talk Alzheimer's today. So what is exactly Alzheimer's?
Well, Alzheimer is sort of a devastating disease. It's a progressive neurodegenerative disease of the brain. What that means is that it's a process that happens in the brain where neurons slowly start to die for one reason or another. And it's progressive in the sense that the more they keep piling up and dying, then the worse the symptoms of Alzheimer's disease gets. And those symptoms are memory loss, behavioral changes, and social interaction changes as well that the people start developing. Alzheimer's disease has a very interesting story. So it was actually discovered in the early 1900s, in 1906 actually, was this very famous German psychiatrist and neuropathologist. It was just two different subspecialties in medicine, very different one from another, although both related to the brain. So one treats the behavioral disorders of the individual that comes from the brain. He decided to go deeper into the study of the brain behaviors and became a neuropathologist as well, which is the physicians that cuts the brain and look at the cellular component of the brain. So he had this patient, August Dieter, who was a patient that started developing what we know today as the disease of Alzheimer's, a lot of memory problems, behavioral changes. And when the patient died, he decided to study his brain. And he cut the brain and looked at it in the microscope. And what he found was that in the neurons of his brain, there were these clumps of abnormal stuff that he called it abnormal clumps at the time. We call them now beta amyloid plaques. So we know exactly now what they are. It's a collection of proteins that happen inside of the cells. And also tangles, a lot of fibers that within the cells that weren't supposed to be there. So he basically described the two major characteristics that we know still today that are the cause of the Alzheimer's disease. We don't know why they form yet, but we do know that people that are start developing those changes in the cells, in the brain cells, end up developing the progressive changes that we see in the Alzheimer's disease.
It is a right assumption to believe that Alzheimer's is related with age, Doc. And my question goes because more and more often I seen information on the web, studies from uni in New York when they link some, gum disease, for example, to causes of Alzheimer's, leaky gut to causes of Alzheimer's, and it is because, according to those studies, they believe that also some foods are creating some disruption on the microbiome. Therefore, all of them, the bacteria shouldn't get into our bloodstream, is getting in the bloodstream and causing some of the, potential causes of the Alzheimer's. So it is a right assumption to believe that it is linked to age. Older people get Alzheimer's easier than younger people, or we're seeing more younger people today getting Alzheimer's disease?
Well, Alzheimer's disease is a degenerative condition. So when we in medicine talk about degenerative conditions, we're talking about wear and tear. So any degeneration of pieces of the body most likely happen because of three things. And I attribute myself three causes for anything that goes wrong or wear off in our body. One is time. So like anything in life, time makes it wear down. So obviously, the older you are, the more chances you're going to have of developing a degenerative disorder. Second one is genetics. So I compare things to cars when people ask me about the spine, for example, and I say, you know what, you can have a Ferrari or Mercedes that is well built, and you have a Toyota Camry that is not so well built, or a Kia that is not as well built as those. Obviously, if you treat the three the same, the one that is best built is going to last you longer. It's going to have a longer age, and it's going to deteriorate less faster. So the genetics gives you that. If you have a good genetics, that means you're well built. If you have bad genetics, damages in your genes that happens in some families, then you are more prone to have diseases like Alzheimer's earlier in life than somebody who will be better built. Now, the third condition is what you do to that car. I mean, even if you have the same three cars, but if you get the Mercedes and you abuse it and you destroy it, it's not going to last you as long as the Kia that you take good care of it and you treat it well. So then the third condition for avoiding degenerative disease is to treat your body well, to take good care of it. And lo and behold, those three things are the only things we know now that are related to Alzheimer's disease. Age, as you pointed out, we know that it's very rare to see somebody with Alzheimer's disease before 65 of age. It's not that age causes Alzheimer's, it's that Alzheimer's is a wear and tear of your brain. It will take time to occur. So it happens after 65, but there's some people that see it after 85. There's some people that see it after 75. There's some people that never see it. But probably if they were to live long enough, 100, 200 years, they will see it eventually at some point. So we're assuming that Alzheimer's, it is a condition that will end up happening in your brain at some point. Bear with me, we don't know the exact cause of Alzheimer's quite yet, but we know that is associated with age and is part of wearing and tear of the brain. We also know that there are some people who have certain changes in their genes in families, like apolipoprotein E is a specific gene that we have found in patients' families where Alzheimer's seems to be very common. And it seems that it's associated with a higher risk of developing Alzheimer's. However, only 5% of the people that do have Alzheimer's have changes in that gene. So we can link it directly one to another. But that comes to the how built you are, to try to see, to associate it with it. Then the most important thing that we have control of is how do we take care of our body. So there are several societal and lifestyle factors that have been closely associated with Alzheimer's in the making it longer last. It occur later in life, or when it occurs in less degree of severity than in others if we engage in those lifestyles, common societal behaviors.
So good you mentioned that, doctor, because that is why we are creating this channel, such as Expresso Health and Wellness Podcast. We are talking about preventive measurements, what we can do from home, from our own responsibility to take care of our vehicle, our bodies, our minds. So having you here to talk about that super important factor, if we take care of that, we can avoid those diseases that affect you, grateful in the later years. So it is so good that we pay enough attention to what we can control, which is environmental, factors, food, relationships we can have with people, many other things that can be affecting our entire bodies. So it is, with all of this, let's say, with this modern life that we are living in, do you think it is an increase of the neurological disorders now rather than, let's say, 100 years ago when we didn't have all of these conveniences, all of these technologies, all of these electronics close to us? Do you think those neurological disorders are on the rise right now?
Well, one thing that we definitely have to account for increases on diagnosis that we see is the longevity. So bear in mind that, the median life age 200 years ago was barely 40 years of age. So most people were dead by 40 years of age. We started increasing that in the 1800s, when medicine started developing and we started to understanding that the way we live and the conditions in which we live affected our longevity, to the point that now we are over 70 years of age in some countries. And there's some groups of people that have a mean age of life of 90, 80, 90 years of age. And what we've done in medicine is try to study why certain groups live longer than others. And we have noticed that lifestyle changes is the difference. There's not been association of genetics or so forth. You got to understand that medicine has those three components that we look at. And if you think of cars again, when your car breaks down, you need a mechanic. So that's what the doctor is. The doctor is the mechanic that takes care of your car when it's broken. But you can prevent your car from breaking down. You can treat it well. You can make sure that it's well built. You can maintain it. You can put the oil changes all the time that you need it. That's what we need to do with our bodies. And that's what we understand that some society groups. I will give you an example. So where I did my training in Loma Linda University in California.
Blue zone.
Yeah. So Loma Linda population, the Adventist population in Loma Linda has the oldest mean lifespan than anybody in the United States and probably one of the most in the world. And they have a specific patterns of behaviors and eating and lifestyle that is very specific to their community. And you like it or not, they get results. They
absolutely, and we want to learn from those. So you live there. You live in Loma Linda. Is considered one of the blue zones in the world, and is right here in the United States.
Correct.
What are the people in Loma Linda, California, doing different than the rest of the population in the U.S. for them to be living longer, happier, and healthier lives?
Well, interesting, and when we're talking about Alzheimer's disease, one of the most important things that has been identified as preventing the early development of Alzheimer's. It doesn't prevent it completely, but it makes it that it occur later in life, is lifestyle factors like choices, physical exercise, routine physical exercise, for example, maintaining healthy diets, diets that improve your heart functioning, and also staying mentally and socially active. And when I one more that is very important is maintaining a good quality of sleep. And when you look at health lifestyle of the people from Loma Linda University and the Loma Linda community, for example, uh, they have a routine in their life. They go to church, they take their breaks every week, they relax, they sleep well, they have their peaceful time with their family, they do regular activity of exercises outside. It's part of their religion or their culture on how they do that. They don't drink coffee. They don't eat red meat. They're very selective with their diet. And there's been two very common, well-known science diets that are associated with decreasing the risk of Alzheimer's disease: the Mediterranean diet and the DASH diet, two ones that are the ones that are being closely associated with it, and has a lot of relationship with the diet of the people in Loma Linda. So those diets promote the ingestion of dairy products, low fat, including foods, and high increased consumption of olive oil, extra virgin olive oil, where all your fats should come from. They suggest to decrease significantly the consumption of red meat, and happy for many people. So they suggest the red wine's inclusion in their meals as well, so that when you have those two diets, both of them happen to be coincidentally diets that help decrease high blood pressure, diabetes, and other diseases that also have been associated with Alzheimer's. Funny enough, those are degenerative disease as well. One is a degenerative disease of the heart and the vessels. The other one is the degenerative disease of your pancreatic and your hormone system. So basically, by using these two diets, you're decreasing degenerative diseases of your body as a whole, not just Alzheimer's, but your heart, your glands, your brain, your muscles will improve because you're maintaining them. You're taking good care of your vehicle.
So from the dietary point of view, we can say that anti-inflammatory diets are overall better to keep our bodies functioning longer, correct, Doc?
Absolutely. So it is believed that the neurofibrillary tangles that we see in the Alzheimer's disease and the clumps, the beta amyloid plaques that we see are actually the scarring effects of an inflammatory process going on.
Wow.
So so inflammation is well known to kill cells in your body. So whatever you have an inflammatory process, there's going to be damages to the body. By decreasing inflammation, by any means that you use, and we use a lot of means medically to decrease inflammation, medication that treats the effect of inflammation, the acute inflammation when we see it. But you can prevent it by having already built up in your body foods and nutrients that will help prevent inflammation. So if you do this preventative, obviously you're going to decrease your degenerative diseases like Alzheimer's.
In our days, and I will say in my original question, the difference between those beautiful population in Loma Linda and the rest of the country, you mentioned something that was so on point. They take their time, they take breaks, they sleep well, they eat anti-inflammatory diets, they keep a sense of community. Well, in most of the cities in our country here in the States, life is stressful. People are on the run. They're grabbing go any food they can find, which is fast food, ultra processed food. Imagine what it's doing to our bodies. This is full of preservatives, colorants, and a lot of bad fats and seed oils, and the body is not ready to digest all of that artificial things that are nothing related to our nature. So it will create inflammation. And I'm curious. I want to go to Loma Linda because I want to see firsthand what they're doing. Is amazing. I've been studying the blue zones for quite a bit, and in different areas in the world, they have these populations that are living longer, happier. And the diets may be not the same, one zone from another, but what they do have in common is what you just mentioned. They live very well.
It's not just diet. So
exactly, so many other things.
Research of Alzheimer's is very interesting in this regard because as we pointed out. So you have genetics, so how you're built. We can't control that. So you can
Correct.
control who you are and how you were born. There is no changes yet. There's no technology for us to alter the genetic component of somebody's a body. We're trying. There's some research, but in the brain, particularly, there's no way you can alter those.
Yes.
We don't know exactly what caused that inflammation in the brain that caused the damage, so we can't treat it. There's no medications for it. So research has shown that there are 5 key elements that are the only things that show some promises in Alzheimer's disease. And brace for this. We
Yes.
just talk about lifestyle factors. It's the
Uh-huh.
number one. So what you eat and how you take care of the body. Cognitive stimulation. So people who engage in stimulating activities, puzzles, reading, learning. Guess what the Loma Linda community does? They meet every week in the church. They have activities where they make you think, they make you interact with others. Cardiovascular health, they have activities that allows you, that makes you walk in there. Uh, they have a very nature life in the sense that they do horses, back riding. They do things that keeps you health stable, particularly continuous exercise. The third one is educational and intellectual engagement. Loma Linda community is built around the Loma Linda University. There are so many classes, and it's not very rare to see an older person, 70, 60, 70, 80 years old, engaged in taking classes in the university.
So beautiful.
Because
So beautiful.
they're learning new things. They're having a third career at the in the older ages. So I love Willie Nelson for many other reasons, but for the quality. But I went to his concert last month. One of the concerts. He's 95 years
I
old.
love Willie. I love
And
Willie.
And one thing that he points out in his songs and his concerts is use it or lose it. So same thing happened with the brain. If you don't use it, you lose it. It's going to get degenerated. So it's like a car. If you leave it in the garage and you never use it, when you go back and try to turn it on, it will be broken down because it deteriorates by sitting still. So you need to stimulate your brain and use it. So educational, intellectual engagement in the older ages prevents your brain from dying off. And then there's clinical and drug developments. Obviously, there are some drugs that have been identified to change the neural stimulators on the brain that helps you with the symptoms of the Alzheimer's. Doesn't prevent it, but try to help you push your brain a little bit to more activities. But if you're not pushing it to use it, the medications are going to do nothing. So I compare it to an amplifier for music. So if you have a very powerful amplifier for music and you turn it all the way up, it's going to give you a lot of power. But if you're not playing any music, you hear nothing. The amplifier will do nothing.
Absolutely. You're absolutely right.
If you're active, you're playing the music, and then you turn on with the medication, the amplifier up, the music will be very loud. So it has to be within yourself. It has to start with you. You have to start having the interest and the activity and the motivation to go out, push your brain to the limits, and then you can get all these other adjuvants with your diet, with your medication that helps you with memory to try to decrease the effects of the devastating disease that is Alzheimer's.
I get emotional when you say that because it is so empowering to know that we can do, and we definitely in our hands is to enhance that state of health that we have. And you outlined those factors so well. And in fact, I have to say that we here in Florida, we have elderly population that is very large, and you see them engage in physical activities. You have them having a sense of community. They want to be happy and live longer, love longer. So they they are so open to engage all these lifestyle changes because they want to enjoy life longer. So it is so much we can learn, and having our minds engaged intellectually is very important. I mentioned many times in this podcast, my husband is 75 years old. He's a veteran from the Air Force. He went to Vietnam. And when someone sees him, they cannot believe it. And not even me. I mean, he is in outstanding shape physically, mentally, he still works, stimulating his mind, and working a corporate job. He is doing his exercises. We have here in my studio, right behind this camera, I have a full gym. I have an infrared sauna. We go every night. So the quality of sleep is excellent at this house. And I always encourage people to do the most they can to really have a good quality of sleeping. It really affects the way that you feel the next day and you perform your activities. Is a lot better than not sleeping well. So this is so much for us to learn from those communities living so long and keeping themselves so vibrant. Thank you, Dr. Santiago, for that expertise. And so good that you were there, living there. You saw it at first hand, the people in Loma Linda. How do they live? And so much we can learn from them. So let me ask you something that is related now with our electronics, the use of our electronics. We are living in a convenient era when everything it is a new manifestation of convenience. The task that we used to do manually at home, everything has been replaced by electronics, make our lives easier. But at the same time, we are getting exposed more and more and more to radiation that those electronics produce. And I'm talking about specifically the use of the cell phone and the devices that the AirPods that people put in, the Bluetooth devices on their ears. I would like for you to pick your brain in what is your opinion on the safety of the usage of those devices, and are they linked to creating tumors on the brain? Is something that we should be aware and take more care of using for the longer exposure on the radiation on those devices?
There has been a worrisome about the radiation effects of some of the technologies that we use for quite a while now. I mean, since these technologies were invented, you have to, and this rise up from the inventor of X-rays, of radiation used in medical care. She died of cancer actually from the exposures to an uncontrolled levels of radiation that at the time was unknown to be damaging to the body. Now, there are two types of radiation. So there is a radiation that is ionizing radiation and non-ionizing radiation. So the ionizing radiation is well known to damage the DNA of the cells. So remember when I said that there's how you're built affects your body? Well, I mean, the ionizing radiation damages the core of who you are inside. So the structure of your DNA changes your genes and then causes cells to behave in a way that is uncontrollable, which is what cancer is. Okay, the cells are not behaving anymore. So they have another nature in themselves that makes them behave in a way that is not unexpected for the body. So X-ray radiations, CT scans, for example, and many other technologies use ionized radiation. They use it at a lower dose to try to minimize those damages because the effect of getting a picture of the damages in your bodies are outweighing the risk of the little bit of ionizing radiation. But we need to control how much of that we get through our lives so that we don't get damages and degenerative condition earlier. Cell phones and other technical devices we use non-ionizing radiation. What we know is that non-ionizing radiation doesn't have the effects in DNA that ionizing radiation has. It doesn't damage the DNA. It doesn't damage the cell the way that ionizing radiation does. But does it cause any other type of damages that we don't know about? That we don't know. It's an unknown in science. There's a lot of research saying there is no close relationship between both diseases. We don't know for sure that it affected or not, but even there were associations of medicine and healthcare organizations have agreed that we're going to put the non-ionizing radiation in the unknown. So we prefer to minimize it. They're suggesting, the World Health Organization is suggesting that you try to use handless devices that they're far away from your body, not only your brain, but your body as well, to try to minimize them. Not because we know that cause damage for sure, but because we don't know. and there's been some relationship.
Well, and you, for our listeners, we have to be cautious because at some point smoking was safe. We understand how much damage after years now, and a lot of the research was a little bit concealed for a long time in the benefit of the big corporations. So right now, there are some studies out there suggesting that obviously the closer exposure to the microwave, technologies and the radiation that constantly the cell phones cause can disrupt some functions on the body. So and for our youth, I will say more because they are all the time on these devices. We as adults, we're working. I mean, we use the phone, but it's not all the time with us. Most of our young people, they use the devices in their ears, the AirPods, constantly radiating to their brain. So that's something that it always gets into a concern just for the preventive measurements. You're right. Using devices that are out, or the phone in your hand and not in your pocket for boys too close to the to sexual organs, and as it would be not safe.
We have to be careful, and everything in life is a balance. So
I know.
you have to walk out and exercise to take care of your body. But by walking out on the street, the car can hit you and you can die. Okay, so there's always risk on what you do or not. So the use of modern technology, even big companies, corporations that are benefit from the technology, they're trying to alter and behave. So you can see how now the cell phones are mostly using your hands, and very rarely you now put it in your ears. Now, yes, the AirPods might be kind of not as decreased, but if you try to use your speakerphone instead of the AirPods, then you're minimizing the closeness to it. So they're responding to it. So we still have to live life and to use technology to improve.
Absolutely.
We have to be very careful because we don't know what it can occur. And I tell many of my patients, so when they come to me, I as a doctor, I have to give them the advice that is being proven to be known to affect. And what that means in medicine is that there have been many studies that prove that something is right. When they tell me, what about something that is not unproven? They ask me questions about, things like acupuncture, like diets and things that medicine has not convincingly proved that is right or wrong. I tell them this is like going to church and praying. I cannot tell you that you're going to get cured by going to church and pray, but I have seen many people who have been saved by the Lord by praying, and miracles have happened. So this is not a proven. Medicine doesn't have the answers to everything. It just has the answer to some things that we have been able to prove convincingly, but there are many others that we don't know. And that doesn't mean that we are saying that they don't work. We're saying, or that they don't cause damage. We're just saying, we just don't know convincingly for me to tell you. What I can tell you in radiation, non-ionizing radiation, is the more you stay away from it, the better.
Absolutely. And we have talked about it on this podcast about the artificial electromagnetic fields, how they interrupt our own electricity in our bodies. And we know that the closer exposure and contamination can cause disruption. We have studies on that. But you are absolutely right. This is our modern life. This is how we are living. And we're not going back to ride horses and live on farms. People more and more and more are populating the big cities. We are getting all of this convenience. We are driving electric cars today. I have one. And I know that by riding a car that is powered by a battery, it is obviously having an electromagnetic field that affects mine, understanding that our safety measurements there, and I have to do my own to do some detoxing myself in daily lives. The use of the phone. You mentioned the radiation that is caused by X-rays and imaging devices. Yes, but we're not having those every day. We're using these things every day, all the time, our cell phones. So it is always, as you mentioned, a good safety measurements, not having them too close. because of that radiation.
Balance is always important. You have to keep the
Balance.
balance in life on how things you do. So, and there's benefits on technology and new advances. There's also might be dangers associated with it that you got to be careful with. But we can go back to the 1800s lifestyle because
Absolutely.
remember the median life age there was 40. So we don't want to die at 40 because we want to avoid the radiation, but we want to not die at 80. We want to prolong it to 100 if we can figure out if we can push it a little bit further out. And but there's conveniences in life because these many other things have helped us in life to get healthier and live longer. So, sanitary conditions that
Longevity. You mentioned longevity. So, Doc, in your experience and all of these years as a professional neurologist, have you seen any, let's say, discoveries on supplements, even medicines that can help us to on the longevity of our neurofunctions?
Well, I mean, there's been certain food and vitamins that we can use. Vitamin D, for example, has been associated with many healthcare benefits. We started talking about Alzheimer's. I can tell you that Alzheimer's vitamin D consumption is being linked to probably a better outcome as well. Omega fatty acids, we know that are very well associated with it as well. So there are other supplements that I can tell you people have been trying to use, and again, we don't know, but they fish related supplements have helped a lot, and in some studies, and some others haven't been proved to be convincing. But there is doubt, and there's doubt that but there definitely there's things that we should stay away as we can. Two of them, I love them dearly: red meat and salt. However, high consumption of both of those two have been associated with significant problems, particularly when you overcook the red meat. So the degeneration that happens in the meat itself, and that's probably one of the effects that I associate with us Latin people, because we learn to overcook the meat. And that's the charcoal that forms in there. We know that from cigarette smoking and all that the charcoal that is generated by overcooking anything, even vegetables, will cause high risk of cancers and high risk of diseases, degenerative disease as well. So it's a matter of being healthy. You can take those supplements. Multivitamin supplements are not going to hurt you, and they have a good chance of helping you. So there's a big industry on promoting them. You have to study and find out what are the risks associated with you, what diseases are running in your family, which ones you want to protect. But maintaining good heart health with the Mediterranean or DASH diet is what the science have confirmed as evidence of helping. So find those two diets, look at what the nutrients they suggest. They're very heavy in nuts and legumes and vegetables, fish and dairy products, and they're very low into red meats and other foods that are damaging to your body. So you learn from those two, and you're going to have a lot healthier condition inside and maintenance of your body.
I am a red meat eater, but I take your advice. And I do eat my meats very, very, very rare, if not totally raw. I mean, I eat the organs raw. And I'll talk about it before here. I don't have any problem eating pieces of heart with a little lemon juice. Boom. It's like a sushi for me. Liver is a little bit more, that is softer. So I cook it very little, but I eat it as raw as possible as the meats. But let me ask you something else. What about the turmeric? Turmeric as a supplement, the consumption of turmeric for anti-inflammatory purposes.
It has been shown to have some effect. So the inflammation in the body is caused by many processes, so that triggers it. And there is enzymatic process that happens. There's also other genetic responses that are pre-programmed on the cells to go through. There's something called cell death that happens automatically when the cells is put through certain stresses. The cells understand understand that they are supposed to go away. So it's an interesting process that happens in the body where some of our cells get a notification, basically a letter saying you're fired. And when they get that you're fired signal, they have to kill themselves, and they start a process of automated cell death where they end up degenerating and dying. So if you alter that message, if you stop that message, the cell tends to live longer. And if you stop the damages that are being attacking the cells to kill it itself, you stop the process of cell death. And anti-inflammatory elements are used to target many sources of damages to the cells and to try to stop that messages of that you need to go away. Turmeric has shown to alter some of them. The problem with these supplements is that you can't say that one stop it all. So there might be other attacks that it won't stop. So it's a combination of elements. Just not by taking one thing, you're going to stop all the inflammatory process in your body. You have to have a balanced diet. You have to have a stimulus to the cells, because nature is so smart. I will tell you, if you sit down on a couch watching TV all day long, nature understands you're useless, and it will get rid of you one way or another. You're going to have a heart attack. You're going to have something going on, but it's nature getting rid of what is useless. And it happens in the wild animal, in the forest, trees that are useless died off. And you think, why is this tree dying when there is another one on the side that is thriving and growing? I mean, nature decided that that one's not good anymore. So we need to fool nature. We need to take good elements to maintain ourselves physical and ready for the activities, but you need to have the activity. If you are not acting, if you're not behaving to a way that you're showing nature, fooling nature by letting it know that even though you're 80, you still need it here in this world, eventually will take care of you one way or another. So staying active and having a social active life where you also take care of your body in a good way is the matter. Is the end of it.
And for our listeners, it's not a magic pill. We have to take different approaches to this healthy style of life. It's not only one thing. It's not one supplement. It's not one vitamin. It's not only one thing only. It is the combination, as you said, Dr. Figuereo, of what we have to do in our daily lives to keep ourselves healthier for longer life.
And there are many things you can do. Look at you with your podcast now, how active you are at this stage of age when many people are thinking about retiring. Many people ask me, when are you going to retire? And I say, never. Why? Because people who retire die. I mean, everybody I know retires, end up dying or getting really sick. I'm not retiring. I'm changing from one career to another. I'm trying to learn my new life. What is the next step on it? So it's like the sports guys that leave a sport and then end up their career of sports. You see how fat and tired up, and they end up dying at the end. The ones that you see in commentary TVs, they're in shows, they're engaged one way or another. You see a Charles Barkley, you see that the guy is never going to go away. I mean, he's still there, very active, doing stuff and
looking great.
Himself on the life. He's looking great. So Shaquille O'Neal, I mean, he stopped. He was supposed to be that long time ago because he's a big guy who has a lot of risk for problems, had a lot of injuries during his career. But now he's engaged in a million other things. The guy doesn't stop. So nature will never get rid of him. It will take a while for him to go away because he is needed in this world. So we have to be careful of fooling nature by letting them know that we're not ready to go. And if we're not, it will keep us here longer.
I think this is also this process of reinventing ourselves. You're learning new skills. You're learning from these new technologies. We are communicating. You're in your house, me in my house, and we got all of these new devices we're learning how to use. We are reinventing ourselves, keeping ourselves always active. And I think and encouraging others to do the same. Some of my listeners are probably about to take that step, like I should be doing more exercising. Well, here is the moment. You're listening this, go. Do a little bit more what you did yesterday. Walking more, walk your dog, do something for the better nutrition today. I will say that every time we're gonna eat, it's just to take a little moment of looking at the plate and thinking, it is this food that I'm eating whole foods. This is natural. How processed is this food I'm about to eat? Is this gonna be good for me? It's very simple question that will take you 15 seconds to realize if this is not something that is good for you. Do this exercise, which is very good. The push out. So don't need it. But yeah, so many things we can do, and it's in our power to create this well-being. Now, let's
I'm sorry to interrupt, but you do it with your car. I mean, when you got to put gas in your car, you choose between the regular gas and the upgraded one and the one that has a determinant. So you have a car that you care about. You use the most expensive gas. You when you're gonna change the oil, you have a lot of options, and you don't pick anyone and put it. You always think about it. Which one should I put? Which one's the best for my car? You ask for your mechanics. So if you're doing for your devices, for your other stuff, why are you doing that for your body? When you go to a restaurant, they offer you food. Why aren't you picking the right one?
correct. So again, this is in our control to choose, and this is why we're talking here, to create this awareness and the people listen at us. And let me ask you something different, Dr. Figuereo, because part of your expertise, and this is beautiful from your resume, and basically for all of these years of experience on helping bioengineers to create devices that were assisting you and many doctors around the world to do minimally invasive brain and spine surgery. So you were part of that creating a process of those devices, and to improve the technology and the way that you needed to be assisted for those minimally invasive surgeries. Now we are getting to the age of artificial intelligence, and I want to get your perspective on where you think is the future of medicine with artificial intelligence.
Well, I got to tell you in a summary, hopefully in a short term, that I was very lucky and appreciate to have trained in an era where there was the initiation, the birth of these new trends into medicine. In the 90s, techniques were coming up. The medicine has been stagnant for quite a while, particularly in the area of what I do, surgery. I'm a brain surgeon, so the neurosurgery of the brain and the spine was kind of the traditional wide open surgeries that we've seen. And I was lucky while I was in Loma Linda training, and did many trainings in many other places, to start playing with new technology that was coming up, particularly the technology of the TVs. So when we were able to see better images, high quality images, HDMI, we were able, and then you get cameras that are smaller and smaller and smaller. I started then learning and try to see how can I use tiny little cameras to look inside the body instead of having to cut somebody open to see what's on inside the body. At the beginning when I started, I can tell you the cameras were horrible and they were very blurry. And you just have to be very well trained to know exactly what you were looking at, because what you were looking at was a picture of you very blurry with a lot of fog in top. And then I had to identify that this is cloudy. I was very tough. Now with high quality images, I'm looking at you now and I'm looking at you like if I was sitting by you, because the quality of the picture is good enough for me to identify you. So in medicine, that started happening in the 90s, and in the 2000s, then the quality of those imaging got better and better and better, and the cameras get smaller and smaller. So then we started realizing that when we do surgery, we are needing to fix something. Remember, I'm the mechanic. So once your body's been damaged and now you don't have a choice, you have to come to me to get it fixed, try to put it back into shape so you can keep functioning. So sometimes the damage that we need to do to get in there to fix the problem is more than the problem itself. No, it's like you have a car that has one little broken piece inside the motor. But in order to get there, you need to disassemble the whole motor because you can't get to it. So now we were playing with how can I get through the little crevices and holes and get in there and fix the problem and come out using minimally invasive instruments. And we have gotten a lot of progress into it. For example, we can take tumors of the brain now through very tiny little hole incisions or through the nose, for example, without having to open your brain wide open. We do brain surgery now without having to cut the hair and shave the hair because we don't need to do big incisions. We can do through a small openings. And in the spine, instead of opening to put screws and stuff, we can do now surgeries with little tiny holes where we can deliver all the screws through the holes using special instruments. So I was lucky to start training when those technologies started developing and then contribute to it. So try to create new tools, new techniques that will help us. And I work close with companies that develop those instruments. I have some patents that we have created on instruments that we invented and designed together. I say we because it's not just in my idea, but working with biomechanical engineers and working with the manufacturers that will make those instruments. We try, we test it. So it's a whole team getting to the point where we know that this little tool is going to help improve the care of a patient. And it's so much so that now it's rarely that I do a big operation because most of my patients are even elective surgeries. We do a lot of surgeries that they go home on the same day. They don't need to stay in a hospital for longer days in miserable pain. That was caused mostly for the surgery. You all have seen somebody who works to the hospital with a problem and comes out in miserable pain that needs to recover from. Obviously, all that suffering is caused by the surgery that was needed to fix the problem. But we're trying to minimize those damages by using these technical advances.
So my mother died of brain cancer. It was so sad when we find out 8 weeks after she died, and she was functioning in a way that we don't even understand, knowing after she was diagnosed how big was her tumor. And when I listen at you and all of these new technologies available for the people today, I have to believe that if those technologies were in place 15 years ago, when she, when probably we could be diagnosed her. I mean, she died in 2015. We find out then, but even then, those technologies were available. Probably we'll have her today. So it's so good. Technologies are as we were discussing, they have the risk, but they have the reward, and they offer tremendous advances right now in medicine. I'm an engineer, so I can totally appreciate it. The work in the combination from somebody like yourself with all of your expertise in neurosurgery combined with the biomechanical engineers putting together the ideas and creating those technologies. And now AI is here. So we're seeing the artificial intelligence platforms. We have the ChatGPT, which is the most common one we are listening now everywhere on the media, but also so many other applications. And then, I mean, you see, for example, if I have to transfer my knowledge as an engineer to someone, it will take years to tell them everything I know about engineering. If you have to transfer all your knowledge about neurosurgery and medicine to someone, it will take years, training and everything. We're talking about technologies that can capture the knowledge and from all different platforms into a single one in nanoseconds. So from the diagnosis standpoint, do you think that these technologies, this artificial intelligence are going to be assisting you gratefully now and in the near future?
Absolutely. So there is a lot of scare media out there about artificial intelligence. Artificial intelligence is here to stay. It's embedded in many things that you are not aware of. Some things that you take from granted now are based on artificial intelligence. And artificial intelligence is nothing more than a computer program that look at information, processes, and give you a response faster than even a brain can do nowadays. So it is very useful for many things. The concern is that it could be used also in a non-human manufacturer fashion, particularly if somebody gets control of it. But in medicine, is going to substitute many of the doctors. So when you are going to see a doctor, you're looking for advice for somebody who has a lot of knowledge. There was a project that started with artificial intelligence, and I guarantee you that it's going to continue and become uh, used commonly in the near future. Looking at neuropathology, so neuro-oncologies. I'm sorry, the neuro-oncologist treatment when somebody has cancer. Nowadays, there are combination of drugs that are useful to treat some cancers. There are genetic treatments. There is radiation treatments that are good for some cancers. The problem is that every day there's new studies showing that there is a better combination. And every day there is a new study that tells you that for this particular person, so for Claudia, female, this age, is different cocktail that works better than for Santiago, a male, this other age. So there's many factors that an oncologist needs to put together to give you the best prescription. Well, the computer can do that very quickly, very easily, and cheap. So this project was started to try to bring the oncology care to Africa, where people didn't have access to very expensive, well-trained neuro-oncologists. And the computer was providing as good or better treatment than the oncologists themselves. So another field that is very advanced already in artificial intelligence, as a matter of the governments to approve it finally through studies proving that it's accurate, is radiology imaging. So reading images is a person looking at the images, and you have the human factor there where they can miss some picture that they didn't see this little detail, but the computer can pick it all up. And so right now there are computer softwares that read images better than a radiologist, so, and can give you that report. We're still not comfortable on letting a computer make the decision for you, but we're going to be relegated physicians to evaluate the results and approve it and stamp it, rather than ourselves making those decisions in the very short term. And there will be in the future, I don't know how near, the fact where with your phone, you're going to be talking to your phone, telling what your problems are, doing some steps, and your phone is going to tell you what you need to do and what's wrong with you. So that is all artificial intelligence. It's a matter, artificial intelligence needs to collect data, make an assumption, and give you a response based on what it is. It can never substitute the professional advice nowadays until we prove that it's better than the professional advice.
Correct. It's still the human interaction is so good, but I think these technologies are gonna be of a help because definitely gonna give you more accuracy. You're gonna provide a better care for your patients because you're gonna eliminate that human error part, which is always possible in medicine. I would say the consumer get like us. We're gonna have tremendous benefits from these applications in the near future.
And you can compare it to self-driving cars, for example. So they're not perfect yet, but they're doing a very good job. So you still have to watch them, you have to monitor them. But as they get better and better over time, they will be better than a person driving. We have robots now that allow us to do surgical procedures, and they're not better than the human touch, but they prevent the errors that a human can have. So while I'm operating, I can cough and then have it shaking in my hands that will cause some damage in the patient that I'm operating on. The robot won't have that. The robot does now activities that were not planned accordingly, and they might have those mistakes. So we have to keep watching it, but they correct some others. So there's still a balance that medicine is playing, technology is playing to try to make it right. Eventually it will be. I don't think that a robot will substitute a brain surgeon in the near future, luckily, so I can keep my job. But eventually, I think it will. It's a matter of time of how humanity evolves.
Okay, I think we're gonna be here to see that at the fast pace that this is going. Everything is advancing on our faces, and as we speak, many things are happening. But Dr. Santiago Figuereo, this has been an amazing conversation with you. For our listeners out there, your last message, if you have to tell them, like, okay, friends, this is my best advice I can give you. for you to preserve your neuro faculties? Happier, longer, healthier? What would be that advice?
I will summarize what we're discussing during this conversation. So you can change your genetic form, what your body is. You can prevent when somebody breaks. You have to have somebody to go get and fix it. But there are key takeaways of how can you prevent problems from happening and maintain a body healthier for longer times. Lifestyle choices matters. So you have to adopt a healthy and active lifestyle where you can reduce your risk for degenerative disease like Alzheimer's disease by doing so. Regular exercise, a balanced diet, mental stimulation. You gotta keep your brain active. It's like you do exercises for your muscles and your body. Mental stimulation is the exercise for your brain to stay healthy. And social engagement is a crucial element. It's so important, not only for you to stay informed about what's happening out there, but also to be able to relate with other people and stimulate your activity for your brain and your body so that it maintains a good, healthy composition.
That is the formula for longevity. Thank you, Dr. Santiago Figuereo. You're invited to my podcast to talk about many other things, but for now, I want to thank you very much for your time and your expertise and your kind words. Has been very empowering conversation, and I know our listeners are going to get very pleased with this information that we delivered today. And for those out there, remember the information of Dr. Figuereo is going to be in the description box, his website, his contact information. If you have a subject to consult with Dr. Figuereo, here is going to be all the information about him. And again, remember that until next time, health is wealth for the body, mind, and soul. I want you happy. I want you healthy. Take care. I appreciate it. Bye, doctor.
Bye-bye. Been a
Bye.
very good pleasure staying with you and talking to you today.
Same here. Thank you so much. If you enjoy our conversation with Dr. Santiago Figuereo, please leave a comment below. Let us know if this subject was interesting to you. Also, if there are other subjects that you would like for us to bring experts to discuss here in Expresso Health and Wellness Podcast. If you will be so kind to leave us a 5-star review, well, the algorithm will help us to make our content visible for others to find this valuable information. Thank you very much. And remember, subscribe to our podcast right here and hit the notification button so you will know next time we're bringing new experts to discuss everything about health and wellness. Thank you.
Thank you very much for listening. And if you like the information that we shared with you today, please subscribe to the Express Soul Health and Wellness podcast and follow us in the social media outlets of your choice. Until next time, please remember, health is wealth for the body, mind, and soul.